Hi, I'm Hannah Skinmaker. This is my fiance Trevor Hillhouse. He's going to be my test dummy for this informative speech. I'm sure you've all seen these AEDs that are around town. They're everywhere from hospitals to sports venues and airports, shopping malls, businesses, doctor's offices, and I borrowed this from my mom's doctor's office. She's an orthodontist, and I was going to inform y'all on how to use it. A lot of people think these are very intimidating. They're not. I promise you. It tells you exactly what to do. This is an AED, also known as an automated external defibrillator. It's a portable device and it sends an electric shock through the chest to the heart. The shock is meant to stop an irregular heartbeat, which is also called an arrhythmia, and it allows the heart to return to normal rhythm following sudden cardiac arrest. Cardiac arrest is when the heart malfunctions and stops beating suddenly. The majority of cardiac arrests result from ventricular fibrillation, which is an rapid, unsynchronized heart rhythm. The heart has to be defibrillated super quick because it has to be shocked back into place. So, whenever you see someone going into a heart attack, sudden heart attack, you're going to see signs from chest pain, discomfort, pain in the arms, pain in the legs. This ranges from men to women. They'll get shortness of breath, and sometimes it's just shortness of breath. But whenever they do stop breathing, that's when you know you need to grab an automated defibrillator and help them. So, this is to be used on anyone from ages 1 to so on. There are different packs in here. I'm going to go ahead and unpack this so you can see everything that comes in it. It comes with a pair of scissors to cut the shirt off. This is ages 8 to adult. So, anyone over 55 pounds or older than 8 needs to be using these pads. This set is of pads for ages 1 to 8, so for littler people. And it also comes with razors because you do not want any hair in that area because it will not let the electrodes stick. Also, if there's any medication patches, you want those removed and you want to swab them down really good because the adhesive will not allow the electrodes to read his heart rhythm. Alright, so we're going to go ahead and pretend that Trevor here has gone into sudden cardiac arrest. Here's what it looks like. Okay? You just hit the on-off button, and he's going to talk to you.
Adult patient, call for medical assistance.
Okay, so what we're going to do right now is we're going to have, if we're by ourselves, we're going to call 911 immediately. If there's other people standing around, you want to tell them, hey, call 911 for me. Okay?
Adult patient, call for medical assistance. Remove clothing from patient's chest.
Okay, so
to expose bare
you
skin.
don't care about the clothing. You're going to want to cut it off.
Pull green tab to remove pads.
See, and he's going to sit here and tell you everything to do. There's a green tab down here. You're going to pull that right out, and it's going to have
Peel
the electrodes.
pads from liner.
You're going to open this up.
Apply pads to patient's bare chest.
And here are the
as shown in
electrodes.
picture. Press pads firmly
So,
to patient's
it has
bare skin.
pictures. This first one is going to go on the top left of the patient's
Pull
chest.
green tab to
Now,
remove
Trevor doesn't
pads.
have any hair there, but if he did, we'd shave that off real quick.
Peel pads from liner.
Place that on there. This other one is going to go on his side.
Apply pads to patient's assessing heart rhythm.
Okay.
Do not touch the patient.
So you're going to want everyone to clear. You don't want anyone touching him while it's assessing the heart rhythm.
Analyzing. Do not touch the patient.
Because it's going to figure out if he has a pulse, if he's in VTAC, which is
Analyzing.
the
Do not
shockable
touch the
rhythm.
No shock advised.
So no
Begin
shock advised.
CPR.
That means that he does have,
It is safe
A
to
pulse.
touch the patient.
and you'll want to begin CPR like the Heartshine Samaritan is telling you to do. So you're going to want to continue CPR. It's going to keep going, telling you to continue CPR. Eventually, it's going to tell us that it's going to want to analyze again to make sure that he still has a pulse. If you do recognize signs of breathing, if he does just start breathing and moving around, you want to stop CPR. Obviously, that's not going to be comfortable. If you can, before you start this, you want to have another bystander start CPR while you're doing this. Of course, they're going to start CPR right here in the middle of his chest, and you're going to continue doing that. Have them continue while you place the electrodes on him. it's not going to get in their way, and this is still going to be able to analyze. Just whenever it tells you to stand clear, you stand clear. So you're going to begin CPR after delivering the shock. You're going to perform 2 minutes, which is approximately 5 cycles. And then you're just going to continue following the AED's prompts and discontinue if you see signs of life or until EMS arrives. Each minute that this person is not breathing, it drops their survival chances by 10%. And if you imagine the EMS call time, they're there in 8 to 10 minutes, 8 to 12 minutes actually. If you wait 10 minutes, then their survival rate goes down 100%. So the faster you can get to one of these and get them on them and start CPR, the better chance that they're going to have to survive this sudden heart attack. The only way right now to restore regular rhythm is currently an AED. And this is what they use in the hospitals.
Assessing heart rhythm. Do not touch
So
the
it's going to
patient.
analyze him again. So everyone stand clear.
Analyzing. Do not touch the patient. Analyzing. No shock advised. Begin CPR.
So then we're going to start CPR again because it
It
did
is
find
safe to touch the patient.
a pulse, and he is alive and doesn't need to be shocked back into rhythm. But yes, the only way to fix a heartbeat that's not regular is an AED. And this is what they use in hospitals, so when you see the videos and they say clear and they put the pads on them, that's what they're doing. And so by now EMS would have arrived and taken over, and they will start CPR and then get him to the hospital. So I hope you learned something. Thank you for watching.